Good morning. My name is Binod Dhakal, and I'm Associate Professor of Medicine at Medical College of Wisconsin. So, in this as we presented a study where we looked at the outcomes of patients who were lenalidomide refractory that were treated in Daratumumab clinical trials. In that study, we looked at all the patients that were treated on a clinical trial, including Daratumumab, for example, Alcyone, Griffin, Cassiopeia, Pollux, Castor. And the goal of that is that the primary endpoint was to look at the outcome of patients at different lines of therapy after they were lenalidomide refractory. So there were patients in 1 line, 2 line, and 3 lines. And what we saw in that study was the response rates decreased with each line of therapy, and also the both progression-free survival and overall survival decreased with each subsequent line of therapy. For example, the overall progression-free survival in these patients was about 9.3 months. But when you break down by the lines of therapy, it is 14 point some months in first line versus about 8.3 months in the third line. So that tells you that these patients have in general the very poor outcomes and would benefit from new treatments with the novel mechanism of action. The other study that we presented was a phase 1 interim analysis of first-in-human NK CAR against BCMA. So this is a very unique product where we used the induced pluripotent stem cells to generate the CAR. And the CAR has a three very unique engineering model, which included the BCMA NK CAR, knockout of CD38 because of the use of Daratumumab, and two other modifications included the fusion of the interleukin-15 for the persistence and the SD16 for the monoclonal antibody. So that the study is included two cohorts of the patient. The first cohort included just NK infusion or FT576, the product infusion by itself, either in a single dose or in the two doses separated in 2 weeks apart. And then the other cohort included infusion along with the monoclonal antibody Daratumumab as per the standard schedule. So this is right now currently ongoing study in the dose escalation phase. We treated so far 10 patients and in this study, and we saw that product is safe so far. In this, so far 300 million cells or the maximum dose that has been given in the level 2 dose, and then there is early responses already happening, and we're hoping that as we go on the higher doses, we will see some responses, anti-myeloma activity, and also some safety data as well.